Video's topic is Structure of Mammary Gland. We'll study skin, stroma and parenchyma. Skin presents nipple, conical projection at 4th intercostal space, has smooth muscle fibers and richly innervated. Areolized pigmented skin around nipple, has modified sebaceous glands, enlarged in pregnancy as Montgomery's tubercles. Stroma has connective tissue and fat. Connective tissue is condensed to suspensory ligaments of Cooper, arranged in radial fashion, connect dermis to ducts. In case of atrophy of these ligaments, breast becomes pendulous. The fat is main bulk of the breast. Parenchyma secretes milk, has 15 to 20 lobes in radial fashion. Each lobe is made up of lobules. Lobe is drained by lactiferous duct. Ducts converge and open at nipple. Lactiferous sinus is enlarged part of duct at termination.